If you are a woman over 60 and you've noticed a new lingering odor on your skin, underwear, or around the genital area, do not panic, and please do not shame yourself. In medicine, odor is not a moral issue. It is a signal. Sometimes the signal is simple: fabric, sweat, dryness, or urine leakage. And sometimes the signal is medical: an infection, irritation, or incontinence-associated dermatitis. Today, I will separate what is supported by evidence from what is internet mythology, and I will give you a safe checklist you can use at home. First, a key fact about aging odor. Research has identified an odor compound called 2-nonenal that tends to appear more with age. It is often discussed as part of the characteristic older adult odor. This is related to changes in skin surface lipids and oxidation, not being dirty. Second, a key fact about menopause and the genital environment. After menopause, estrogen declines. That can change the vaginal ecosystem. Lactobacilli often decrease, and vaginal pH rises. This matters because lactobacilli help maintain an acidic environment that discourages overgrowth of certain microbes. This is one reason irritation and infections can become more common after menopause. Now, here is the most important safety point. A new or strong odor is not always pH. It can be bacterial vaginosis, yeast infection, or other infections, urinary tract infection, urine leakage with skin irritation, skin disorders such as dermatitis, or rarely other conditions that need a clinician. So I will give you a two-part plan: safe basics and red flags. Habit 1. Stop irritating the vulvar skin. The vulva is external skin, but it is sensitive. Many gynecological guidelines recommend avoiding perfumed products and avoiding harsh or antibacterial soaps on vulvar skin, especially if you are irritated. Often, warm water alone is enough. If you prefer a cleanser, choose a mild, fragrance-free product and use a small amount with your hand, no scrubbing tools. Important: the vagina is internal and self-cleaning. Do not douche. Do not put soaps, vinegar, or reset mixtures inside. Habit 2. Keep the area dry, especially if there is urine leakage. If you use pads or liners for leakage, change them regularly. Older adult skin breaks down when it stays wet, and urine exposure can increase skin pH and irritation. After cleansing, pat dry gently. Do not rub. If you have frequent leakage and irritated skin, barrier creams are often standard care, but choose them with a clinician's guidance. Habit 3. Choose breathable fabrics when you are prone to irritation. Many vulvar skincare handouts advise breathable cotton underwear and avoiding tight, occlusive clothing when irritation is recurrent. Textile research also suggests odorants can behave differently in polyester than cotton and can be harder to remove from some synthetics. This does not mean synthetics are forbidden, but if odor and irritation are problems, breathable fabrics are a reasonable trial. Habit 4. Towel and underwear hygiene. Simple, not dramatic. A towel that stays damp or smells musty when wet is a common practical problem. The evidence-based principle is not sterilize with hacks. It is wash appropriately and dry completely. Avoid leaving towels wet in a pile. If you use fabric softener and your towels stop absorbing well, consider stopping it. Poor absorbency can leave skin wetter longer. Habit 5. Avoid DIY acids on genital skin. You may hear advice to spray vinegar, especially apple cider vinegar, to restore acidity. Clinical studies in other skin conditions show dilute vinegar frequently irritates and does not reliably improve the skin barrier. Genital skin is often more sensitive, especially after menopause. So, as a general recommendation, do not do routine vinegar sprays on the groin. Please contact a clinician promptly if you have any of the following: burning with urination, frequent urination, fever or pelvic pain, new discharge, bleeding or significant itching, painful cracks, spreading rash or open sores, rapidly worsening odor or odor that persists despite gentle care. These are not soap problems. They are medical signals worth evaluating. Let me finish with the most respectful truth. Many women feel embarrassed by this topic, but odor after 60 is often manageable, and sometimes it is the early sign of something treatable. The correct response is not panic and aggressive scrubbing. The correct response is gentle care, breathable habits, and timely evaluation when red flags appear. If you want, I can provide a one-page safe vulvar care checklist for 60+ for your family or patients. Simple language, no myths.